Hello, Professor. For this assignment, I chose the statement that creatine use is harmful. And I have a creatine bottle that people are using as a supplement. So first of all, what is creatine? It is a supplement made from amino acids, and it aids in production of ATP for energy in the body. So ATP is used for glycolysis and other metabolism things. And so it is naturally occurring in our body. So this is a supplement, so that means we're adding more of what we actually have in our body. So people are trying to decide if it's good or bad and when is too much. So people such as athletes can do short-term use, which is 20 grams a day. But an average person would be doing 2 to 10 grams a day. So 20 grams a day is pretty extreme, but we are seeing average people do 2 to 10 grams a day. And then on the right side, I have what creatine looks like in the powder form. So that's the supplement that they make. So next, who's using it? Professional athletes. And I found in my source that 75% of athletes from the 49ers and the Broncos use it. So you're seeing majority of athletes are actually using it today. And this makes sense because they're using a lot of energy. They're using up a lot of ATP. So they're using creatine to help aid them in creating ATP and using it. And then also Navy SEALs, which makes sense because they're also exerting a lot of energy in what they do. And then 90% of weightlifters do it. So that's also interesting. And I think that's where everyone started discovering it. I feel like I heard about it like on TikTok. And it makes sense for these people to be doing it because they're trying to build more muscle. And that is why they're doing it. If people want to build muscle, they're using creatine. So why are people so concerned? There is arguments of it harming the kidneys, and people are also stating that there's hair loss and dehydration and gastrointestinal issues such as vomiting or having an upset stomach, and really just upsetting your gastrointestinal tract and causing cramps in the stomach. So this picture I have on the side is someone making a TikTok video saying creatine can destroy your kidneys. So this looks like it to be like someone in the medical field, but we're trying to decide if this is actually true. So what's actually happening? I looked at several studies in this review, and it said in one study done by Greenhalgh, participants in the study were given 20 grams a day and did not experience vomiting or an upset stomach. So they are thinking that maybe it's underlying issues, that people are seeing vomiting or upset stomach, but it's not proven to be a part of creatine. So we can debunk that statement that it is harmful to the gastrointestinal tract. And then in a study done by Gordon and then all others, patients with heart disease were given 20 grams a day of creatine, which strengthens skeletal muscle endurance. I think that this is really important because they stated that they could, in the future, use this as supportive care for people with heart disease and maybe a therapy that they could try to just help strengthen their overall muscle endurance. And so creatine is beneficial to people, especially people who are already having some other diseases. It's not going to make you worse. But there's also a study done by Ernest and then others stated that no significant changes in the liver metabolism. So what this is saying that people were concerned that it was affecting the liver also, but once they did a trial with people using creatine, and there was no significant findings of it changing liver metabolism. So the liver was able to metabolize normally, so that's overall good, and it wasn't affecting it in any negative or positive way. So it is harmful for patients with existing kidney disease. And this is important because if you do have underlying kidney disease, then you should not be taking it. That's what they're recommending, and that's what they discovered in this research. But however, it is not harmful to everybody, mainly only if you do have kidney disease. So that's important to know. So it can be beneficial to people, of course, without kidney disease. So the results, should you be not be taking creatine? I think this is false. I think that creatine is okay for people to take, especially since creatine is already something that we're metabolizing in our body. So adding a supplements usually shouldn't harm you too much. And I think that this is okay to have unless you do have kidney disease. Thank you. Oh, and here's my references.